Well, thank you all, and Dave, I want to thank you for your very kind words and for the leadership that you're showing to the business community in the greater Lubbock region. And also want to thank the Lubbock Chamber of Commerce for all that you all are doing, as well as all the business and community leaders who join with us today, but also who really work every single day in lifting up the entire Lubbock region to being a shining star in the premier state in the United States of America. Dave, you mentioned leadership in the Capitol, and any governor knows that leadership is a process of working very collaboratively with the members in the Capitol. And I do want to recognize your very own Representative Dustin Burrows for the leadership that he shows every single day in the Texas House of Representatives. I know that his colleagues, Senator Perry and Representative Frulo, also wanted to be here. They are in Austin, committed to work as we speak. I also want to recognize the mayor. The mayor and I have worked on multiple issues, whether it be COVID-related issues or Arctic blast-related issues, whatever the case may, whatever the case. Although that's kind of typical for you guys up here. That's nothing new for Lubbock. And one of the premier education leaders in the United States, and that is the Texas Tech Chancellor, Ted Mitchell. Thank you for everything that you're doing. And I especially want to thank Rudy Rosales, right here. I think everybody knows Rudy, as they should. But Rudy, I want to thank you and your family. I got to meet Rudy's mom, Maria. I don't know where she is right now, but Maria, I know that she's been working hard getting ready for this, as well as the entire family. So, Rudy, thank you. Thank you. Thank your family. And I want to thank your employees and your staff for hosting this event at Montelongo's Mexican restaurant. Many of you in Lubbock know the story about this restaurant and its legacy, and I know about it, but I was shown pictures of the originator of it, and that is Rudy's grandmother, Petra Montelongo, who opened this restaurant about 50 years ago and built it into what has become a Lubbock treasure. Rudy and his family, they typify the entrepreneurial spirit that does make Texas so exceptional. Because of people like Rudy, Texas does remain the economic engine of the United States of America. Texas has been ranked #1 in the United States for business for 16 straight years. Texas has led the nation in exports for 19 straight years. And if Texas were its own country, we would now have the 9th largest economy in the entire world. And even with this past year of COVID, Texas has remained the #1 state in the United States for economic development. Yesterday, Texas received the Governor's Cup. The Governor's Cup has been received by Texas every year that I have been governor. The award goes to the state that ranks #1 in the United States for job creation and for capital investment. And Lubbock, Texas, bolstered that success with 12 Governor's Cup projects in 2020. Thank you to Lubbock and the Lubbock Chamber of Commerce. You know, that success was achieved despite COVID's impact on business operations. For nearly a half a year, most businesses have been open either 75% or 50%. And during that time, too many Texans have been sidelined from employment opportunities. Too many small business owners have struggled to pay their bills. This must end. It is now time to open Texas 100%. Everybody who wants to work should have that opportunity. Every business that wants to be open should be open. Now, let me tell you why now is the right time to do this. Texas is far better positioned now than when I issued my last executive order back in October. And we are in a completely different position than when I issued my first executive order last March. Back then, hardly any Texan knew what PPE was. Now we have an abundance of it. Early on, there were no COVID tests. Now we have the ability to do well over 100,000 COVID tests per day. When COVID first ravaged our communities, there were no medicines to treat it. But now we have antibody therapeutic drugs to treat COVID and to keep people out of hospitals. In fact, as you all know, I was with the mayor and I was with the chancellor as well as other Lubbock leaders when we formally announced the rolling out of these antibody therapeutic drugs and making them available in large-scale process to people in Lubbock as well as people across the entire state of Texas. And we also have multiple medical advancements that help Texans heal and, importantly, help keep Texans out of hospitals. And last March, most Texans had no clue about the precautions needed to avoid COVID. Now, Texans have mastered the daily habits to avoid getting COVID. But most importantly now in Texas and across the country, we now have vaccines to protect Texans from COVID. More than 5.7 million vaccine shots have already been given to Texans. Today, we set a one-day record amount of vaccines administering more than 216,000 in one day alone. And we're now administering about 1 million vaccine shots a week. By next Wednesday, about 7 million shots will have been given to our fellow Texans. Equally important, we are getting the vaccines to the Texans who need it the most, those who are most likely to be hospitalized or lose their life because of exposure to COVID. By next Wednesday, over half of our seniors will have received a vaccine shot. And by the end of this month, every senior who wants a vaccine shot will be able to get a vaccine shot. To help this effort, I have already announced a statewide program called Save Our Seniors. Along with that, I deployed more than 1,100 National Guard to assist local organizations to help our seniors get the shots they need. These efforts should ensure that we keep hospitalizations low in Texas. Importantly, the number of vaccines will continue to increase rapidly, with additional supplies of the Pfizer and Moderna vaccines, as well as the new vaccine that's come out by Johnson & Johnson, which is a one-shot vaccine that Texas began administering today in the state of Texas. In fact, get this, the vaccine supply is increasing so rapidly, Texas will soon expand the categories of people who are able to get them, and some medical professionals say that within a few months, every Texan who wants a vaccine shot will be able to get a vaccine shot. And something else happened this past year. Almost 2.5 million Texans were lab confirmed for having recovered from COVID. The CDC says that the real number of recoveries is typically 4 to 5 times the number of those who officially tested positive and recovered. Mathematically, what that means is that approximately 10 million Texans, or really more, have recovered from COVID and have the proven ability to beat the disease. Now, all of these advancements and events have led to remarkable improvements. Hospitalizations are the lowest that they have been in 4 months. The number of active COVID cases is the lowest since November and is less than half of what it was just a month ago. That means that far more Texans are recovering from COVID than contracting it. Also, today is the lowest positivity rate we've had in 4 months. We have been under 10% positivity rate for days now. Today we're now under 9% positivity rate in the state of Texas. But make no mistake, and to be clear, COVID has not suddenly disappeared. COVID still exists in Texas, in the United States, and across the globe. But it is clear from the recoveries, from the vaccinations, from the reduced hospitalizations, and from the safe practices that Texans are using, that state mandates are no longer needed. So today, I'm issuing a new executive order that rescinds most of the earlier executive orders. Effective next Wednesday, all businesses of any type are allowed to open 100%. That includes any type of entity in Texas. Also, I am ending the statewide mask mandate. Now, despite these changes, remember this: removing state mandates does not end personal responsibility or the importance of caring for your family members and caring for your friends and caring for others in your community. Personal vigilance to follow the safe standards is still needed to contain COVID. It's just that now state mandates are no longer needed. To stay safe, Texans should continue following medical advice on preventing COVID just as they do on other medical issues. That is exactly how Texans were able to deal with infectious diseases in the past, like H1N1. They followed safe practices and they got medical treatment when it was needed. For a year now, Texans have wrestled with COVID, and they have learned best how to conduct their own lives. For example, if businesses want to limit capacity or implement additional safety protocols, they have the right to do so. It is their business, and they get to choose to operate their business the way they want to. At this time, however, people and businesses don't need the state telling them how to operate. Now listen, I know that some local officials are concerned that opening the state 100% could lead to a worsening of COVID in their communities. And my executive order addresses that concern. If COVID hospitalizations in any of the 22 hospital regions in Texas rise above 15% of the hospital bed capacity in that region for 7 straight days, then a county judge in that region may use COVID mitigation strategies in their county. However, under no circumstance can a county judge put anybody in jail for not following COVID orders, and no penalties can be imposed for failing to wear a face mask. Also, if restrictions are imposed at the county level, all entities must be allowed to operate at least a 50% capacity. More importantly, though, we believe that there will not be the threshold met at hospitalizations for county judges to even consider implementing those strategies, because Texas will continue working collaboratively with all counties to speed the vaccination process. So putting this all together, Texas is doing more than ever to save lives and to reduce the spread of COVID. We must now do more to restore livelihoods and normalcy in the lives of Texans. We will continue to grieve for all who have suffered through this pandemic, and we will always mourn the loss of all lives. We are relieved that Texas now has better tools and more knowledge than ever before to help our fellow Texans combat COVID. Today's announcement does not abandon the safe practices that Texans have mastered over the past year. Instead, it's a reminder that each person has their own role to play in their own personal safety, as well as in the safety of others. It's a reminder that individual safety is managed every day as a matter of personal responsibility rather than by government mandate. Individual responsibility is a corollary to individual freedom. We can have both. Today's announcement ensures that Rudy Rosales and his family, just like all businesses and families in Texas, have the freedom to determine their own destiny. Just like all Texans, they can tap into their own self-reliance to seize the opportunities that are so unique in Texas and that make our state the most exceptional in America. May God bless you all, and may God forever bless the great state of Texas.
Hey there everybody, Will Dupree in the KXAN live studio in Austin here with Wes Rappaport. We are tracking a big development that Governor Abbott was sharing just a few moments ago, saying that he is ending most of the restrictions for COVID-19 that were put in place almost a year ago now, starting the rollout of that. But Wes, tell us about the timeline he laid out just a second ago.
Well, he says that he is removing the mask mandate, the statewide mask enforcement. It sounds like all of these orders are to start next week, next Wednesday. Basically says he is rolling back many of the orders that he had put in place during this pandemic. So the mask mandate will be out. He also said that it is now time to open Texas 100%. So he says that he is allowing all businesses in Texas to open at 100% capacity, with a few exceptions basically being if a county ends up with a hospitalization rate of COVID-19 that's above 15% for more than a week, the county judge can then hop in and request a waiver to limit that business capacity. But beyond that, Texas businesses will be allowed to reopen to full capacity starting next week.
And I will say that we've been tracking some of the reaction in anticipation of this event. The governor had hinted that this was coming, but officials here, at least in Austin and Travis County, have been reacting so far. Earlier today, in a joint brief in front of the Austin City Council and the Travis County Commission, Dr. Mark Escott, the interim health authority for Austin Travis County, said he hoped that this mask mandate at least would not be lifted until April. That is not going to be happening now because the governor says, according to his announcement just a few moments ago, that by next Wednesday, the mask mandate will no longer be in effect and that all businesses will be allowed to reopen again at 100%.
Yeah, I just saw a tweet from a Republican strategist pretty heavily involved in the Texas Capitol who said, this is good, cases are falling, vaccines are going up, and people are practicing social distancing and masking. It's time to open up and let our economy boom. So that seems to be at least one of the sentiments that is coming in light of this announcement, the governor said, he acknowledged, removing the state mandates here does not end personal responsibility. He said that there are still medical, protocols and medical experts to listen to at this point. He said, we still need to continue following medical advice. So I will imagine that there are, some conversations that will happen here in the next 24, 48, 72 hours that will have some differing medical opinions on what medical advice we do need to be listening to.
Yeah, for sure. And the governor notably did not take any questions from there, even though there are a number of reporters gathered. And it looks like we may have lost our live signal from the restaurant there in Lubbock. Once again, we were looking live inside a restaurant where the Lubbock Chamber of Commerce had a meeting, and Governor Abbott joined them to make this announcement. I also want to highlight something he said in predicting about vaccinations. A lot of people are wondering when the categories that will be available to get a vaccine will expand. The governor did not give a specific timeline on opening up to 1C. Currently, only people in 1A and 1B can get the vaccine, but he did say that Texas, he said, quote, Texas will soon expand categories of people who are able to get them, and followed that by saying that may be available in months. So again, no specific timeline on when vaccinations will be expanded, but he highlighted some numbers with the number of shots that have been administered so far.
Yeah, he said, I think the number was 5.7 million vaccines have been administered to Texans, and just this week, it sounds like the last 24 hours, more than 216,000 shots in one day alone, a new record set within the last 24 hours. So definitely using this opportunity to highlight some of the triumphs that have come with this pandemic, the ability to vaccinate millions of Texans. Keep in mind, we do have 29 million and plus Texans in this state, so 5.7 does make a dent, but it is not close to everybody. And he took this opportunity to highlight some of the efforts that his administration has taken to try and reach people that have had challenges with getting vaccinated. That Save Our Seniors program, using 1,100 National Guard soldiers to bring vaccines to seniors using a partnership with the Meals on Wheels folks. That's one of the things that has been launched in recent days. 26 initial counties participating in that effort. So he's taking this opportunity to highlight some of the successes, but also acknowledging that there still is a road ahead, and acknowledges that there is personal responsibility here, that he just thinks that it is not time at this point for the state to be mandating how people exercise that personal responsibility, choosing to exercise that individual responsibility at this point.
Yeah, we should note that a lot of health experts are sounding the alarm about coronavirus variants showing up. There have been instances of variants that were first popping up in the United Kingdom, South Africa, Brazil has had one as well, and a lot of health experts are saying that, yes, we have had incidents of those and reports of those here in Texas at least, and some of them are more contagious seeming, but they fear that those variants might cause, they might be more severe in the effect that they have on people. So I didn't hear any mention of that in the particular remarks there, but I know that a lot of medical experts have been sounding that alarm and saying that's a reason why not to lift certain restrictions at this time.
Yeah, this is something that is going to be debated quite a bit. We've heard from different people at different levels of government with differing perspectives on how to approach this.
Yeah.
Some states handling things differently than others. I know there's been, Texas gets compared to California and Florida quite a bit, being, similarly large states. And so I think that, as we see what has happened here, there's no doubt that he's looking at what other states are doing and not necessarily, using those as blueprints, but seeing how it worked, seeing what has happened, and seeing what can apply to Texas. Texas is proud of its independence, and on this Texas Independence Day, no less, going to take its own actions, but certainly weighing what has happened in other states carefully in this decision.
If you are just joining us, let's reset the table and just let people know about what's happened. So we lost our live signal to this event that the governor was holding with the Chamber of Commerce in Lubbock, but he did announce that as of Wednesday next week, that all businesses, every single business in the state, can open up at 100% capacity again, and those restrictions will not apply to them. Also, he is ending the statewide mask mandate. As Wes pointed out, he did say that now the responsibility falls on individuals, and the time is now to lift all those restrictions.
Yeah, the governor adding that if a hospital capacity in one of the hospital districts, the 22 regions across the state where we've been tracking hospital capacity, if that hospital capacity of COVID-19 patients, it reaches above 15% for a week or more, county judges can request reduced capacity for business occupancy for a temporary waiver, essentially, from the state. So now the governor putting this on local officials to enforce and police these decisions, and puts that, not just talking about personal responsibility for individual Texans, but also personal responsibility for local governments to act.
We should also point out that in that caveat that county judges can step in to impose some restrictions, they, however, cannot enforce any penalties for people not wearing a mask, and they also cannot jail anyone for violating an order.
Yeah, the governor said Texas is, quote, doing, quote, more than ever to save lives, end quote, and reduce the COVID spread, but he said that more must be done now to restore livelihoods. So clearly not an accident that he's at a small Lubbock business with a storied history of entrepreneurship and this relatively small family business that's been around about 50 years. He says that the Lubbock business community has been a shining star in the region and helped lift it up the entire Lubbock region on a statewide level, both for legislature and also helping to earn Texas another governor's cup for a record-setting year.
Yeah. And if you're just joining us again, I'm Will Dupree. Wes Rappaport's here with us in the KXAN live studio in anticipation of the governor likely announcing something like this. Yes, he has taken these steps now officially, but I did have a chance to speak to an infectious disease doctor. This was for another program that we put on every month here at Nexstar, but I did ask him. He has dealt directly with COVID-19 patients and has also participated in the Pfizer-BioNTech vaccine trial. And I asked him, what he thought about the Texas governor and other officials across the country lifting restrictions right now. And I want you to take a listen to what he had to say. Again, this is Dr. Stephen Thomas from upstate New York. Yes, he is from out of state, but he has been commenting and following the developments with COVID-19 all across the country. So let's take a listen to this.
My opinion is that is premature. There is no question that, when you look at the 7-day, 14-day trends for the majority of the country, the vast majority of the country, those trends are all good, right? We've seen some pretty rapid decrements in terms of the number of new cases every day, the number of new deaths every day, the percent positive tests that are being performed every day. But they've leveled off, right? So for the last couple of days, there's been a leveling off at still a pretty high number, right? I mean, we're used to, really, really high numbers, which is unfortunate that we've gotten used to that. But this is still a significant amount of transmission that's occurring. So that's one thing. The other thing is, again, these variants, right? They really have not started to take off yet like they will. So the UK variant, a couple thousand people have been infected, a couple dozen people with the South African variant. And so that's the second thing, is I'm worried about those variants and what they can do. And then, the third thing that I'm worried about is, there's still, both federal and state governments are still figuring out how to perfect the logistics of immunizing millions and millions of people. We'd like to be immunizing, 2 to 3 million people a day. We're nationwide. We're not really there yet. So for all those reasons, I would continue to stick with with the current plan, because again, even in the absence of vaccination, public health interventions work. We know they work, right? Anyone who's skeptical about that, just look at the absence of influenza and the absence of RSV, which is a virus that infects young children and older adults every year, and it's basically absent this year, and it's because of physical distancing, washing hands, and wearing masks. So so I would stay the course. I think it's premature.
Again, Dr. Stephen Thomas from Upstate University Hospital in Syracuse, New York. He participated and led part of the Pfizer-BioNTech vaccine trial initially. He's been a resident expert for us, touching base about COVID-19 and the spread. And again, he said that lifting restrictions is premature right now based on the presence of variants and the unknown effect that will have across the country, plus the relatively low vaccination rate all across the U.S. Bring it back in Wes Rappaport now, because we are getting additional statements, reaction to what the governor has just shared, in that all restrictions for businesses are lifted 100% by next Wednesday, and the statewide mask mandate will end.
Yeah, let's go to a reaction from Texas House Speaker Dade Phelan, just sending that release moments ago. He says the unparalleled efforts of government and the pharmaceutical industry to defeat the novel coronavirus prove what we've always known: vaccines work. He goes on to talk about the treatment options and decreasing hospitalization rates. He says today's action marks an important step in the reopening of Texas, improving the mental health of our students, increasing the reporting of domestic violence and child abuse, and revitalizing our business climate. He also talks about the safeguards in place to prevent the spread from increasing as the state reopens, acknowledging this year's been difficult for all Texas families, and there's hope now that we will defeat and eradicate COVID-19. Clearly a message of support there from the Texas House Speaker in his first session in that post.
Yeah, and we also have reaction coming in from the Democrats, the Texas Democratic Party sharing a statement. Wes, I don't have that available to show right now, but if you have it pulled up,
sure,
I might let you share some of the reaction from the Democrats.
Basically, the Texas Democratic Party, the chair, Gilberto Hinojosa, says what Abbott is doing is extraordinarily dangerous, calling him the worst governor in modern Texas history. He says this will kill Texans. Going on to say, on this Texas Independence Day, once again, Abbott's actions are made independent of logic or reason. What Abbott calls pro-business is anti-people. Make no mistake, opening Texas prematurely will only lead to faster COVID spread, more sickness and overcrowding in our hospitals, and unnecessary deaths. This statement, several paragraphs, but concluding with, by removing all previous state mandates and opening the state to 100%, Governor Abbott, who has never taken this pandemic seriously, is doing what he does best, leaving Texans to fend for themselves. So clearly the Texas Democratic Party with some choice words for the state CEO there.
All right, everybody. Thank you all for watching our stream. We are going to continue covering this because I would imagine that even more reaction will keep pouring in at this point. As you can see at the bottom of the screen, Governor Abbott says by next Wednesday, all businesses in Texas will reopen 100%, and he is going to end the statewide mask mandate. Wes Rappaport, thank you for joining us and providing your perspective and reporting. We appreciate that.
Thanks, Will.
All right, everybody. Thank you all for watching. I'm Will Dupree here in the KXAN Live studio. We'll see you back here another time. Please, everyone, stay safe and healthy, and take care.